That's okay. All right, thank you very much. So we've sort of flip-flopped between patient and provider tools. We started out with provider, then we went to patient and provider, and I'm going to finish it off and balance it with the patient side, really empowering patients. I'll also add a little political. I know Berkeley is blue, but I'll have to tell you on Google traffic this morning, all roads were red going into Berkeley. So it took quite a while. So, all right, so we'll switch it up a little. There we go. Okay, start out with just a bit of context setting, traditional disease management, and then move into what I want to describe as personalized healthcare. And by that, I don't mean personalized medicine, the genomic and genetic aspects of medicine. I really mean personalizing or customizing healthcare. So as you mostly recognize, traditional disease management is actually outsourced. And you hire this company, they have their separate mini medical record, and they do things, and the communication's not so hot. They also follow a protocol where you got disease, we got treatment. In fact, as people know in evidence-based medicine, you only are allowed one disease. We don't have diseases really that encompass multiple comorbidities, and that's one of the issues. So it's typically set up as a call center. In fact, this is an ad I saw from one of these companies, and what it says is we have a 70,000 square foot air-conditioned space where you too can call patients. And basically it's sort of, I call it nurse badgering, and that's not meant in a derogatory way. It's a badgering system to see if patients will adhere to the sort of the treatment plan that's been prescribed. Well, I'd like to offer an alternative because people don't feel like they're just another sort of cog. They don't feel like they're just, I got disease, here's the treatment, period. Because we're all different. We have a different ethnic background. We have a different part. We're in a different part of our lives. We're just plain different. And I think the theory is that if we treat people as individuals, because we do have these differences, we might actually have a better chance of engaging them. So what do I mean by that? If it's person-centered, then we all have our family histories. We have our sort of just background. We also have our own version of a disease. If I'm a diabetic, I may be insulin requiring, I may not be. I may be overweight, I may not be. I'm very different. And the other piece that's not considered is my agenda. So typically as a physician, and I'm a physician as well, you give the shotgun approach. Okay, you got this disease, these are the things you need to know about, and that's the end of the visit. Versus, okay, are you interested in changing your diet? Are you interested in changing your exercise pattern? What about meds? Those are the things I may be ready or not to change. Why don't we consider that? And that's what I would call my action plan then. So the personalized health care program I'm talking about is really customized care for each individual because all those things I just listed are different. The other trick to disease management is the code word's multidisciplinary health care team. That's code work or a euphemism for get it out of the hands of the doc. And many things will go better. Typically it's going to be a nurse, a pharmacist, but basically for a number of reasons, the doc doesn't have enough time in the 15 minutes, but also there's a lot of people specialized in working with the various aspects of an individual. So the way we do it is first we have been using an EHR since 1999, it's almost 10 years. And as you can imagine, the things that were traditionally in a paper medical record are there. But let's add things that are outside of the exam room, like the glucometer readings. And like your readiness to change, what are you interested in changing in your life? Because you're more than your sugar in the case of a diabetic. So we do have evidence from the literature, best practices. Ideally what you'd like to do is combine what do I know about me and what does medicine know about diseases and treatments. So we do put those as inputs into a reasoning engine and then spit out the customized plan for you, taking into account your agenda. That is overseen by a nurse care manager who has a number of tools that are at her disposal. Right now we have 2 women. And I'm going to walk you through just a couple of those. So the key here, I think, is connecting the dots. We talk at patients in the exam room and talk to them for a diabetic. I'm going to focus on that as an example, about their sugars. And the way they perceive it, so when we look at it from focus groups or home visits, they think of going to the doctor to get yelled at about their sugars. That's not actually what it means to take care of a whole patient with diabetes. So instead, let's give them the tools. And so my perspective is patient person, that's the person with the biggest vested interest. What we owe them is data, knowledge, and tools to manage their health condition. And in my example today, diabetes. And we will be advisors, paid counselors. So you acquire the reading, and what do we typically do is we say, okay, we'll put that on pen and paper, collect that in a diary, bring it to us, and we'll sort of flip through it. None of which really makes really good clinical sense, because we are not doing a good analysis, and we aren't connecting the dots between what's my behavior that contributes to this reading. So what we did is we designed a way to get the electronic numbers out of the glucometer and pull it all the way to our system so that we can show it back to the patient. So we do that by wirelessly, because this whole go home, connect to your computer is sort of last century. So we wirelessly go from the glucometer, which is an electronic gadget, to a cell phone. And why do we go to a cell phone? But everybody has a cell phone virtually, and it's connected no matter where you are. So wherever you are, restaurant, wherever you're eating, can wirelessly upload the stuff to our server, which again, as I say, is there for you to see as a patient. And that's where, if you're the one that's seeing, because you know what you ate and you know whether you exercise or not, then you're making the interpretation of the number and the trend that has the most meaning. So that's what's the theory will change your behavior. Oh yeah, we'll get a carbon copy. Why? Because that's what you hired us to do. And at the appropriate moments, we'll step in and provide you feedback. But this is about changing your behavior, not just in disease. It's a chronic condition. Being overweight is a chronic condition. Being sedentary is a chronic. We need to change, make health a daily living thing. So here's an example. How do we give it back to you? So here is the blue boxes are glucose fasting. The green ones are pre-meal. So you can annotate these things in the glucometer. And here is your carbohydrate intake. As you can see, gosh, slowly decreasing glucose, slowly decreasing. And here's what I mean by connecting the dots. And so you're also able to annotate. So what happened here? Well, the patient annotated, went to Black Angus for dinner. And it's not a diss on Black Angus, it's just restaurant. And so that's what happened there. I went back to my calorie, and things got better. That's connecting the dots. Diabetic for over 10 years, that's the message. It's not that your sugars are bad. That's the message you get from us. This is the message they need to change their behavior. Another example is the minute we went up, within 2 weeks of starting this program, found 2 episodes of hypoglycemia in 10 patients. One was 60, one was 33. The 33, the woman who had 33 felt really crummy and ate pizza as a treatment for that. But has she ever had that before? Sure enough. But is the way we get information good enough to detect that? Probably not. Now that we have this, we can get it right away. In this particular case, of course, we called her. But the other thing is that's the teachable moment. So I can give her the information, what do you do when you get hypoglycemic? But that, again, text is somewhat limiting. Let me try to get my mouse here. Another powerful way is to give them some, if I can get over the right place. So what I've done, since we're not connected to the internet, I had to download this, and that's why I'm having trouble getting this.
Lower blood sugars are good, but there is a danger of too much of a good thing. Symptoms of low blood sugar include irritability, anxiety, or lightheadedness. You might feel sluggish, sweaty, or develop a headache. When blood sugar becomes really low, you can get neurologic symptoms like tingling, difficulty thinking, and changes in personality. You can even lose consciousness. The danger of having too frequent of episodes of low blood sugar is that you stop feeling early warning symptoms and only become symptomatic at very dangerously low levels. Now, if you think you're having a hypoglycemic episode with symptoms, and this typically happens when the blood sugar falls to less than 70, test your blood sugar right away. If your blood sugar is less than 70, follow the rule of 15. Eat a 15-gram fast-acting carb snack. That's a half a cup of fruit juice or a tablespoon of sugar or honey or 4 round glucose tablets. Wait 15 minutes and recheck your blood sugar. If it's still less than 70, repeat.
So I'm going to start, but you can get the messages. I could have either told you when you're feeling fine in the office the same stuff, or you can have this when you felt the symptoms. Which one is going to be more effective? So as I said, we had an alpha group, we had a beta group. This was one of the best things that happened to the project team, is to sit and listen to the folks after the beta and describe what they got out of using the system. So in the first instance, they start out testing the sugar, perhaps more frequently than they used to. And why did they do that? Because they're in this new program, and they think that we care. But about 1 to 2 months later, they're now testing it for themselves. So they're realizing that, oh, look at the feedback I get. I have pasta, my sugars go up. One person liked beer, and he already knew that beer just drives the sugar up. Then he found out that light beer doesn't. And so he was teaching the rest of the group that you can still have beer as long as you do the light beer. So this other guy was saying, you know, I love ice cream, and that just drives my sugars sky high. So then this other guy says, you know what? If you exercise, your sugar goes down. So in fact, I can exercise. My sugar will go down lower than it normally is. Then I can eat ice cream, and it'll still be okay. And it's sort of this kind of, but what you're seeing is the connect the dots. They've been diabetic for a long time. We've told them these words, you know, talk at them for a long time. Figuring out what I do that affects my control of my disease is the difference. So the summary is, I think it's a matter of personalization. It's not really blabbing. You know, we complain about 15-minute visits. What if we had 30-minute visits and blabbed at them? I don't think it's going to be any more effective. Give them something to help manage their own care. I think that's really effective. And if it's personalized, instead of shooting the shotgun with the same things about doing it, you have to do all these things right at the same time, it's just not very engaging. So the piece here is this technology. We could not do this on paper because you can't print so many versions of paper. So we can do that in the electronic world. And what happens is we're now giving them a tool to sort of be a co-equal player on this team or on the field, and putting them on the healthcare team. And I think that's the key. So we need both the physician-facing side and the patient-facing side if we want everybody to play in the same game. So really what I'm saying is this technology actually is not the end in itself. It's just the means to put patients back on the healthcare team. And with that, I'm happy to answer your questions during the question session. Thank you.